This presentation is a description of the process of creating science-based care plans for patients outside of the healthcare system. While healthcare providers have been creating care plans, these are predominantly used for inpatients. These care plans are designed to engage and touch the patient outside of the traditional healthcare system. So what is a care plan? Care plans connect patients with their healthcare team and caregivers outside of the traditional healthcare setting. They connect patients to digital and interactive tools, and they connect data from the patient, including biometric data taken in the natural setting, such as the home, to their electronic health record. These plans are all based on evidence-based guidelines, as well as a strong conceptual framework for the prevention of cardiovascular disease and stroke. And these programs are focused primarily on post-acute care, so patients with heart failure, coronary artery disease, cardiac rehab, stroke, high blood pressure, but they also incorporate conditions that may cross many of these programs, such as high cholesterol, diabetes, having medical devices, being on oxygen therapy. And there are core components, such as the development of an exercise and nutrition plan, as well as an overall plan for setting goals and objectives. So what is this process? The process starts with source documents, such as the guidelines and statements themselves. Patient selection, identifying the core components, target metrics, establishing goals, priorities, and action plans, developing an assessment plan, an education plan, and a communication plan. All of these must involve progression in knowledge, literacy, and skills. And finally, it all has to be tied together through effective evaluation, both of the process as well as the outcomes of the plan themselves. So the plan, the process, first is identifying the basis of the care plan. So a strong care plan needs both a conceptual or theoretical model as well as an evidence base, which forms the guidelines and recommendations. Another key factor is who is the target population. Are these patients self-identified, or are they identified by the healthcare provider? And how are they invited to participate and enroll in the care plan themselves? So we look at these plans as concentric circles, beginning from the inside of the circle, identifying the core components. So, for example, are the core components physical activity, nutrition, medication management, and stress management? The next level out are the target metrics. So these may be such things such as blood pressure, glucose, body composition, and lipids. Finally, how are goals and objectives defined and prioritized? By whom? What is the timeline? And who is accountable for this? And then finally, how is this program evaluated? And this must include individual progress as well as overall program metrics themselves. So the care plan itself, going clockwise around, once the care plan itself has been identified, then it involves a personalized invitation to the individual, a series of monitoring and management of these core components and target metrics, focusing on accountability and behavior change, and then the evaluation and reporting process. And this is a cyclical process. It's not a static. It's not a singular event. It's a process that is ongoing. So the assessment plan itself. So how are target metrics assessed? Well, first of all, the target metrics must be aligned with the core components, and align with the goals and objectives of the program. And of course, these goals and objectives must be achievable within the timeline established. These metrics may be quantitative or biometric, which can be uploaded from a device or entered directly by a patient. They may also be qualitative or subjective, and those are going to be entered by the patient. All of these metrics are assessed and captured in the system. These data then are accessible to the patient as well as to the healthcare provider, and there's a two-way communication that goes on between the patient and the provider, and in fact in many cases a three-way communication with the caregiver, leading to decision support tools. So these may include recommendations to the patient. These recommendations may be in the form of an educational plan, and the decision support to the provider is information and feedback, and may become part of the communication plan. So the assessment plan, the education plan, and the communication plan here are all linked. It's important to note that these plans are not plans for treating these conditions. They're plans that are really focused on the provider. These plans are designed to help the patient manage their conditions. Slightly different focus. The education plan is designed to take the patient through their zone of learning. So, because if the level of information is too basic, then it may not be interesting enough for the patient to engage, as well as if the information is too complicated, again, it may be more difficult for the patient to understand. So some key questions: how are knowledge, health literacy, and self-management skills developed? Is the patient empowered to be an active partner in this process? And then a key component is promoting self-efficacy of the patient. The patient's belief that if they engage in this program, they're going to be successful, and their goals and objectives are going to be met. So the care plan empowers the patient and caregivers by targeting their learning zone to build knowledge, skills, and effective condition management. The multimedia part of the component, this is part of the education plan. What educational assets, interactive tools, and digital media can be used? And importantly, what is the credibility or the source of these assets? The program is designed to build a support structure using the metaphor of a scaffold. We build a scaffold around a building while it's being constructed. These care plans are a scaffold being built around the patient while they're going through this process of learning. Once they have developed these skills and knowledge, and they have become empowered and engaged, then the scaffold can move away, and the patient can go on to continue their own self-care behaviors. The components of the scaffold are developing the goals and action plans, assessing education and information for self-management and healthy living, staying accountable by connecting with healthcare professionals, caregivers, and other patients, and tracking results, such as biomedical information. The next leg of the stool is the communication plan. So when the assessment is completed, if the assessments are not completed in a timely manner, then a plan for re-engaging and informing the provider is set in place. But if the assessment is completed, then it's a series of providing feedback both to the patient as well as to the provider. And in both the patient and the provider, there's two forms of feedback. There's things that need to be fed back immediately in the form of alerts or directly within the system. There's also things that can be used for follow-up in the form of messaging. Finally, the evaluation plan. So there's two components. Evaluation of the individual. So are the target metrics valid and can they be measured reliably? What is the basis for comparison? Is this a pre to post? Is it a comparison based on a benchmark? And ultimately, what does success look like for the patient? Is it improved control, feeling better, having more energy? Using the example of life as why. So what is the why for the patient? Why are they doing this? And finally, evaluation for the program. What are the program goals? Are they clinical or operational, or probably a combination of both? Can these objectives be measured within the system, or are there other sources of data required, such as financial and utilization data? What is the basis of comparison here? Is it another program? Is it a benchmark? And finally, how many participants will be needed, and how long will it take for these questions to be answered? And finally, these care plans are deployed. This is a transformational process going from written documents to interactive tools that are then deployed through technology platforms. So that is a key to delivering the system in a scalable and sustainable manner. So I want to thank you for participating in our brief overview of the care plan development that we use for connected heart health.